Okay, Kate, can you see my screen?
No, I'm not seeing your screen yet.
Diana, can you see it?
Yes, ma'am. I'm wondering, did you go to the login on the calendar, Kate?
Yes.
Okay, so Mike, how about you?
Let me see here. I'm trying to get Patti into.
Okay. Can one of our members that's on chat, can you all see our screen?
This is Lindsay Query. I can see your screen.
You can? Okay.
Yeah.
Great. All right, Kate. So you let me know. What I'll do is I'll stop sharing formally, and then I'll reshare. Give me 1 second. All right, Kate. So I unmuted you, Mike, and Diana. Give me 1 second, Diana. And Patti, you are going to be up next, but I don't see her on the list. All right, folks. So we're going to go ahead and get started. Happy New Year. Welcome to your first learning session for the National Pediatric Readiness Quality Collaborative for 2019. Your presenters today will be Kate Remick, myself, Crystal Bartley, Diana Finya, and then we will have members of the NEDARC team, with that being Mike Ely, Eddie Zamora, and John Brummett. Just as a couple of acknowledgements, HRSA is supported in part by the U.S. Department of Health and Human Services under the grant that's listed. So please keep in mind today that none of the information or content should be construed as the official position or policy that are endorsed by the entities that are listed. So what we're going to do is go ahead and get started with the roll call, and we want you to use that chat box. So anyone on the call from Alaska, from the Last Frontier Kids? How about the Lifesavers? That's Cardinal Glennon Children's Hospital as the training site. Anyone on the call from Mocan Rocks, Team 3? Great. Nice to see you guys, Olivia. How about Team 4, Dell Children's Medical Center, Longhorn Kids? Anyone on the call from that team? North Texas Division HCA. And I see that Dell's on the line. Thanks, Danita. How about Fight or Flight, our team out in California? Great. The folks on the East Coast, how about the New England EMSC team? And I got you, Ashley, in Dallas. Welcome, Medical City. We have Cohen, 8 is enough. How about Augusta in the South? Then we're going to go up to Indiana, the pit crew, that's team number 10. And how about those remocked minions from the Chicago area? Great, Diana, we see that you're here. And then we have one of our large teams. How's Wisconsin doing? Anyone on the call from Wisconsin? Welcome, Wisconsin. How about Team 13? That's going to be Wrangler for Kids, Providence St. Vincent. We've got our Alaska team. Welcome, everyone from Alaska. How about the Oregon Pediatric Readiness Program? That's another one of our big teams. Great, Rachel. And I see that Team 13 is here. How about Tennessee? Hi, Oshana. And lastly, Pediatric Peaches in Georgia. Great. So we have a full house. If we have any subject matter experts, feel free to say hello. You know that you're going to hear from NEDARC, the EIC, and we always like to hear from our sponsors at HRSA. So what I'd like to do is walk you through some of our talking points for today's learning session. Kate's going to spend some time with you talking about the collaborative timeline. Eddie will give you some great updates about our data use agreements. We'll spend about 15 minutes talking about planning for your baseline and your first PDSA cycle. We will have the NEDARC team talking about the data entry system, and then I'll follow up with everyone at the end to do some housekeeping. So Kate, I'll let you take it away.
Through the timeline for the collaborative, I know that things have moved a little bit more slowly up front than we had anticipated. Unfortunately, this, getting DUAs in place and getting the data entry system up and running has just taken a lot more time than we expected. When we set out this collaborative, we, of course, set dates to plan to end in December of 2019. And so just kind of walking through where we are and what's ahead over these next 12 months, really, and then talking a little bit about, well, what happens afterwards since we're starting so late. So, over these first 6 months, a lot of the work has been focused on these administrative tasks, making sure that we got some initial site visits and team calls in place, making sure that we identified data stores and QI stores and getting environmental scan completed, of which I think many of you have done, but there's still a few of you that haven't yet completed the environmental scans in full. Getting access to those IHI modules and, making sure that you all have a good sense of quality improvement science and the work that's going to be done, walking through the intervention bundles and the like. So here we are now in January, mid-January to be exact, and our goal really for these next 2 months is that we're going to make sure that we can begin to collect and submit baseline data relative to any or all of the intervention bundles that we plan to or hope to work on. And in order to do this, we're going to talk a little bit about, PDSA cycles and some strategies and how we're going to work through that. But that's really going to be the focus over these next month and a half as we move forward. As we jump into February, that's when we're really going to get into the work of the collaborative, running through Plan, Do, Study, Act, our PDSA cycles. We're going to begin to really identify some best practices and report out. This is the acceleration phase. This is when we're going to really be doing the brunt of the work. And our hope is that by the time we, reach into the summer, that all of you will feel really comfortable with the process of implementing these cycles. Hopefully we'll identify ways of being really successful, things that work for you, and be able to push forward in a pretty, autonomous way as we, move into the fall. As we get into the end of this year, November and December, that's when we really need to start focusing on sustainability planning. As all of you know, pediatric readiness is not a one-time act. It requires maintenance just like anything else. And so it's how do we create sort of an active engagement or process within our sites to make sure that we don't just achieve a level of pediatric readiness, but also maintain it. So we'll be talking about strategies to really ensure that we hardwire those changes into our system. And then we'll have some final reporting out from the teams at the very end of the year. But we recognize that we'd really hope to have a good full 12 months of really working through all of these PDSA cycles. And, while you think about other collaboratives, this is still certainly in line. We want to make sure that we continue to support you all. So we are planning on holding at least a feedback session or check-in in the first quarter of 2020 for those of you that are still able to participate or engage in that. And we'll put that on the schedule. We don't have it yet, but we recognize, that the delays may have been frustrating and or make you concerned about the process or the progress that you'll really be able to make. During these next few months, as we're really ramping up and through that acceleration phase, there will be some fireside chats that we'll talk about. Those are going to be intervention-specific calls. And it's going to be really important that if you're working on a bundle or thinking about working on a bundle, that you participate in those, because we're really going to be getting into some of the best practices, keys for implementing certain change strategies and the like, and opportunities that will help make you more successful on your site. In addition, it's going to be really important that you work with your team, your PRQC team, and the trainers to make sure that you're able to stay on track and seek support and help from the others that are on your team about identifying next steps. And I'm just going to give Crystal and Diana a couple minutes to see if they have anything they'd like to chime in.
I'll quickly comment, Kate. I think one of the beauties of collaboratives is that it provides resources from one another to help move your projects forward. And our hope would be, even though the collaborative is officially scheduled to end in December with a final check-in early in that first quarter of 2020, our hope would be that relationships are built amongst the team members as well as with the trainers, that those folks who are at affiliate sites will feel comfortable in reaching out to their trainers and their training sites as they need additional resources and additional assistance as they work on pediatric quality improvement initiatives. So I think one of the real pluses of collaboratives is that it provides that relationship building and that opportunity to work with one another to continue to improve the pediatric emergency care that's being provided around the country.
Hey, Kate, I think it's important just to manage everyone's expectations about that acceleration phase. We are going to ask that you enter your baseline data and then move into your first PDSA cycle, but we aren't expecting that first PDSA cycle be some major initiative, for instance, EMR optimization. It could be something that you decide to do as just a small, quick win. It could be pushing out some knowledge reinforcement, putting posters in your triage room related to abnormal vital signs. And so I think that will help teams build a momentum, and it will also show your colleagues in the emergency room that you're taking sort of a concerted effort over time to make these changes instead of everything all at once. So we'll definitely be working with you through your baseline and your PDSA cycle, and then I think by the summer you guys will definitely be comfortable rolling out new change strategies. And as Kate mentioned, the sustainability piece, we will not let you guys go in December. And especially if you've done the work to do that planning in the fall, we really want to be able to see if some of these change strategies that we've identified really work on their own without, and more turnkey rather than there needing to be a champion to monitor these things day in and day out. So I'm looking forward to what the teams do, and we're definitely going to be accelerating these next couple months.
Thanks to both. And, we have spent, our colleagues, I should say, especially NEDARC, have spent a lot of time developing our whole data entry system. And so, this isn't something that we're going to be shutting down. We hope that it'll provide or serve as a long-term resource for folks interested in working on pediatric readiness. So the DES, the data entry system, will not be shutting down in December 2019. That would prevent you guys from continuing to do this work. So that will remain open and remain available to you and we're really grateful to our colleagues at NEDARC for making that happen. So in the upcoming learning sessions, as we move through into this acceleration phase, we've done a lot of the, ramp up and education on, QI and pediatric readiness and intervention bundles and implementation and the like. Today, we're going to obviously be spending a lot of time talking about the data entry system. But as we move forward, you'll see that our learning sessions develop a more specific structure, making sure we provide any potential updates to data entry, to dashboards. In February in particular, we're going to talk a lot about data display so that as we move forward in the collaborative, you feel comfortable with run charts and the like. But as we move forward, you'll see a lot of focus on how everyone in the collaborative is doing, aggregate data on performance and progress. And then most importantly, as part of a collaborative, it's really being able to learn from each other. So we're going to start, reaching out to you all to be able to share some of those best practices, just as we heard from our teams back in November with some of those initial best practices were shared. We'll continue to do that throughout the course of the collaborative. So I'm going to turn it over to Diana for a few minutes to talk about the fireside chats.
So from the beginning, we've identified subject matter experts to help us not only in developing the bundles, but also getting a commitment from each of them to be available to both the trainers and the affiliates as they work on the individual bundles to make improvements in their processes at their institutions. So in order to utilize them and have them available to you, we have planned some opportunities for you all to meet with them 3 times between now and June, or actually as we start the acceleration phase, we'll be starting that in February. And each of these calls will include a hot topic that the subject matter experts will present on. Some of the things that we've been discussing at this point in time, specific steps that need to be considered when you're transferring a child from one facility to another facility to assure that things go expeditiously and that children and the care team are kept safe during that transfer. We've also talked about the elements, the newer elements that are being included as for assessment of children and should also be considered as part of abnormal vital signs. So we're beginning to talk through the hot topics, and our subject matter experts will be presenting about 15 to 20 minutes on a hot topic. We will also be addressing frequently asked questions, and those questions are to come from our trainers and from the affiliates. No question is too ridiculous to be asked if it's causing a problem for you at your institution. Therefore, we're going to be sending out a note prior to the fireside chats and ask that you, if you've got questions or concerns or things that we need to consider in regards to the individual bundle that's going to be discussed at the fireside chat, that you submit those to us, and the subject matter experts will be addressing those issues as best as they can, given the time frame. And there will be additional time, hopefully at the end of the presentation, to address other questions that folks may come to mind to them during the presentation itself. All of the chats will be recorded, and they will be posted on the website for you all to access. So just in case you're starting with abnormal vital signs, but you want to move on to interfacility transfer, please feel free to access it via the website or plan on joining them. You can join all of them if you so desire, if all of these areas are things that you would like to work on. The frequently asked questions that are submitted are brought up for discussion at the fireside chat. That information will also be gathered and will be collated and put together sort of on an FAQ fact sheet that will be posted on the website. So if you've got questions at the end of this, make sure you let us know if you've got questions specific to the fireside chat. And that's it for me. I'm going to turn it back to Kate, I think.
Great. Thanks, Diana. And just to answer a few questions that have popped up in the chat box. So first off, all of these fireside chats, we've tried to have them fall on Tuesdays since that's when our learning sessions typically fall. So we want to try to create some consistency. There is one date in February, February 11th, which is actually a Monday. Unfortunately, in order to accommodate all of our subject matter experts for that particular bundle, that was the best that we could do. But following that, they will fall on Tuesdays thereafter. All of the times listed here are in Central Standard Time, so make sure you note that according to your time zone. We will be displaying these at the end of today's learning session as well. I would recommend that you at least try to write some of these down, but we will be sending out a blast email with invitations, and it will go to everybody in the collaborative. We recognize that you're likely only going to start with one bundle, may choose to work on 2 total, maybe 3 or 4. It depends on your site and your goals. But we don't want you to miss out. So if you'd like to join them, feel free to join them. If you don't, that's okay. We will be recording these. They will be available online for you. And again, with those blast emails, we'll be asking for the FAQs. So hopefully that answered all the questions. Okay, Crystal, turning it back to you on data use agreements.
Sure. Eddie, are you on the line?
I am. Good morning. Good afternoon, everyone. So this is a snapshot of the latest report. This is last week's report. Not much has changed, but we do have about 80% of the sites that are on their way. And what I mean by that is about 60% are fully executed. A smaller percentage are getting that signature phase, and that means that's about 6 or 7 sites, if just to give you a number. And about 16% of the sites are in negotiation. Some of those negotiations take a little longer just because really trying to find alignment between the University of Utah and the respective hospital or health system. And then we have about 20% of sites, or about 20 to 25 sites that are in the status of other. We had a call with EIC last week, and we will be maybe directly calling these sites and starting to engage them from the PRQC admin side, and then we'll be asking the training sites to help us with maybe engaging those if we have a contact that we can reach out to, kind of getting a little more urgency with that 20% that really might need some more support. And I have been receiving some emails in the last week since this report went out from some of those sites. But yeah, we're definitely pushing through and trying to get these agreements in place. Any questions from any of the teams regarding the DUA process?
And feel free to put any questions in the chat box as well, and we can see them there.
Okay. And that's just a snapshot report of all the sites that are fully executed as of now. And some of them are network hospitals, including Wellstar and Medical City that were fully executed in the last couple of weeks. And that you can move to the second slide. For these sites, we have Fairchild and Providence, and all those are moving forward, and so we'll be having signatures for all those pretty soon. And when those are on our end, so we're just securing signatures for those sites. And then we have some sites in negotiation. The large network hospital represented here is the Ascension System. We're currently trying to address some of their technical assessment needs with that site. When they get executed, that'll bring a lot of other sites into the collaborative. And then the other ones are moving forward in different steps. I can always clarify one-on-one. These are the sites that are in others, so that means that we've had some communication with them or limited communication. And again, since last week, I actually spoken to maybe about 5 of these sites, So we're hoping to get that process moving forward.
Thank you so much, Eddie. I know this has been so much work moving through this process. I know this was more work than folks had initially anticipated. For those of you that are fully executed, you are good to start entering data as soon as the data entry system is officially live. So that's exciting. For those of you in the signature phase, hopefully will be soon, and we'll get login information as soon as those are completed for your data stewards. Those of you that are in negotiation, we're working through some of that as expeditiously as possible. Eddie and his team are really doing a fantastic job of trying to work with each of the different groups and teams and legal entities with each of these sites, but I know that these are quite close. And for those of you that fall into the other category, if you see your hospital on there, you haven't heard an update, or for those of you that are trainers and you see any of your sites on there, we would strongly suggest that you reach out either to the local teams and or to Eddie to try to assist or facilitate and find out at what point in the process you're at. But kudos to everyone for making this happen, and especially to Eddie and his team for all the organization that's been required around this. So at this point, we wanted to just do a brief kind of overview again of these PDSA cycles and what we're talking about and how that correlates with the data entry system. And then we're going to spend the great bulk of this learning session with our NEDARC colleagues showing you the data entry system, what it looks like, and kind of walking you through it so you feel more prepared and ready to move forward. So before starting any of the Plan, Do, Study, Act cycles, what we have suggested and why the administration components or documentation components were first is that we have to figure out where the gaps are. And certainly the PEDS readiness assessment, that gap analysis was a really important initial step. The environmental scan really walks through very specific gaps within each of the intervention bundles to try to identify where some change strategies might be. And for those of you who did your environmental scan, you will be receiving a copy of that environmental scan if you didn't already print it. And you're encouraged to, of course, share that with your team, your local team, as well as your training site, so you can make some decisions about where might be those quick wins or easy wins that Crystal was talking about earlier. With part of that came the selection survey, which is trying to choose which of the intervention bundles you really want to work on. Once you've chosen those, make sure you download a copy of the deep dive that was on those intervention bundles, and also a copy of the initial foundational presentations. And then, of course, the implementation guide will be a great resource to you because it'll help you to identify what are the local considerations that you need to put into place. Do you need other stakeholders at your site involved? How do you bring them on board? And it really gives you an opportunity to work into those PDSA cycles. So once you've selected your intervention bundle, then you need to start thinking about who's going to be in your patient population. You know, if you're working on abnormal vital signs, it might be those patients that were triaged at a higher level. If you're working on weight and kilos, it really could be any pediatric patient that presented to the emergency department. But for the baseline data, just like any of the other PDSA cycles, we're asking that you all select at least 30 patient encounters. And those encounters, you can go as far back as January 1st of 2018, which is when we really officially kicked off this collaborative. So if you wanted to, and especially for those sites that are lower volumes, you could pull patient charts retrospectively to see what your performance was relative to any of these intervention bundles and use that for your baseline data. If you have difficulty or you don't have a means of really gathering those charts retrospectively, going back through the ED, it is absolutely fine to do it prospectively, but you should do it before you begin discussions about specific change strategies or actually implementing any of those change strategies, as that will change your baseline performance. And then really, it's just that once those discussions start, and this is the last line here, is just that once you start discussions or start people thinking about pediatric readiness, it starts to modify how folks act, because they know that that there's some awareness of performance. And so that's why, any encounters that you choose should really reflect a period of time before any interventions were introduced. So if you move on to the next slide. So the start date for the baseline data is whenever the first patient encounter is that you chose for their baseline. It could be as early as January 1st, 2018. It could be as late as, January 30th, 2019. But whatever, is the first patient encounter, that's really the start date for your baseline data. Identify those charts. Figure out where you're going to be able to pull those variables if you want to. As we're working through the final piloting of the data entry system, you can create your own manual paper version for entry by going ahead and pulling those variables, so that then you can go back and enter them at whatever time. And you'll see that those paper versions that we introduced on the last collaborative call are indeed available on the PRQC website for you guys to use. So essentially, once the data entry system goes live, that baseline data can be entered. The other piece that we wanted to mention is that it's fine to enter baseline data for more than one bundle. We all, recommend that you really start intervention with just a single bundle, so that you can make sure you have that focus and that things are moving forward well. But the baseline data can really be useful for really choosing which of the intervention bundles is your priority. There is a comment that came up that there may be a few sites that had already started working on their first cycle or going through some PDSA. The challenge here is that you need to be able to pull baseline data from before that cycle started. So yes, every site will have their own start dates for each PDSA. So you'll have your own start date for your baseline data, your own start dates for each PDSA cycle. You just need to make sure that the baseline data occurred before any interventions. Otherwise, you can't demonstrate improvements in performance and or improvements in readiness. So hopefully that's clear. So if we move to the next slide. So after you enter those 30 encounters for your baseline data or performance, then that allows you to look at that performance and create next aim statements for your PDSA cycle. And so really, with all of these, what we should be doing is trying to craft a global aim. Where do we want to be at the end of this 12-month period? So at the end of the collaborative, and where do we want to be for each of those PDSA cycles? So there's the global aim, which is 12 months from now, and then there's the SMART aim, which is for each PDSA cycle that you activate. All right, and just to answer that question, I know it says that it was answered, but there was one question that came up. How long do we collect baseline data prior to an intervention? It really depends on your site. If you're a relatively high volume site, you could get 30 patients in 2 weeks, and that's sufficient for a baseline time period. If you're a low volume site, it may be 6 months to collect all of the pediatric patient encounters that you need. So it's really dependent on your site. We spoke in one of the previous learning sessions about data sampling and how you might choose that to create, some random generation if you're, a high volume site, or if you're a low volume site, it might be that you're collecting data on every patient encounter. Okay, thank you. So moving through the PDSA cycle, once you've collected that baseline data, look at your performance. That'll be available on the dashboard. Establish your specific aim for that cycle. And then you might want to get back together with your local team as well as the PRQC team to try to decide what key drivers you want to focus on, what change strategies you implement. It's important to note because on the data entry system, it's going to ask you this. What is the start date of your first PDSA cycle and subsequent PDSA cycles? Really, the date that you enter there should be sometime around the time that you convene your local team. Any patient encounters that you enter into that PDSA cycle should occur on or after that PDSA cycle start date. The baseline data can be closed out and there can be a gap before the next PDSA cycle opens, but it's really important that the date you mark for the start of your PDSA cycle is somewhere around the time that you're identifying your key drivers and selecting change strategies. After that point, you'll formally announce your plan and spread the news or implement that change strategy. And again, we recommend starting with only one intervention bundle first, but as you move through the collaborative and feel more comfortable with the process, you may choose to work on multiple intervention bundles at any given time, even though you might be in different PDSA cycles during each of those. For subsequent PDSA cycles, you should continue to monitor the data. There will be essentially daily updates on the data entry system for your performance, so you can continually go back to your dashboard and look at how your site is doing based on the data that you've entered and make a decision about whether or not it's time to close out that PDSA cycle and move on to the next strategy because you've achieved a certain trend of stability, or whether there's still more improvement happening and more work to be done. So whether you've entered those 30 encounters or not, you might say that you want to stick in that PDSA cycle a little bit longer, continue to monitor performance before moving into a next PDSA cycle. Once you've reviewed that performance data and you feel like it's time to close out, then you can begin to think about what is the next SMART aim going to look like. Get back together with your local team, set that start date for PDSA cycle number 2, 3, and so on, and then move forward with your change strategy and spread it to the whole ED. It's going to be really important with each of these PDSA cycles that you work closely with your local stakeholder team and also with your PRQC team and trainers to make sure that you're comfortable with next steps and ready to move on and have all the resources available to you. For those higher volume sites and for those sites that have strong stakeholder support and engagement in this work, your PDSA cycles may be really rapid. They might occur every month. Every month you might be implementing a new change strategy and be able to move really quickly, and you could move through 5 PDSA cycles in maybe 5 or 6 month period. For other sites, whether it be because of patient volume or because of local engagement, it may take much longer to move through a single PDSA cycle, maybe more like 3 months, in which case you're only able to really move through 4 or 5 throughout the course of the collaborative. But it really depends on your site. There's no pressure to complete a PDSA cycle very quickly or any feedback that we're going to have about taking more time to do so. It's going to be site dependent. Our goal is just to give you the tools, the resources, and everything you need to be most effective. One thing to note is that when you go to close out a PDSA cycle, the data entry system will ask you whether or not you achieved your SMART aim. It's just a yes-no question, and it's based on the SMART aim that you devised. So just be prepared to answer that based on the performance data. And this is really just so that we know that you're able to monitor your performance on the dashboard and be able to make a decision about whether or not to close out that PDSA cycle. If you go to the next slide, we wanted to just briefly mention about the interfacility transfer bundle. Not all children who come to the emergency department end up being transferred. And so for low volume sites, this may seem to be a much more challenging bundle to engage in. And our feedback to you is that it's absolutely fine to still engage in this bundle. Just know that your PDSA cycles may be much slower because it might be every 30th pediatric patient that actually gets transferred that you're actually going to be able to look at your process. So remember, our goal is 30 patients for each of these interventions. Even if it takes 6 months to complete a baseline or a single PDSA cycle for interfacility transfer, there's still opportunity to really look at the structural elements that are part of this intervention bundle and make sure that all those components are truly in place. And even if you're just entering baseline data for this for this bundle throughout the course of the collaborative, you'll still be able to identify performance. So there will still be run charts that are created for each of the quality measures relative to this bundle, and it will at least give you a sense of where your site is relative to interfacility transfers. So there's no requirement that you work through a certain number of cycles related to any or even this particular bundle. Really, the focus is on creating that global aim and doing your best to achieve it by the end of the collaborative. And that global aim will be site-specific based on where your baseline is, what your gaps are, and the level of stakeholder engagement and support that you think you have at your site. So at this point, I'll turn it back over to Crystal to talk just briefly about some of the key drivers we mentioned in each of the intervention bundles.
So our team was very mindful that some of the affiliate sites had already started rolling out interventions, but we would just want to give you a quick snapshot of the types of key drivers or categories of interventions that your team must sort of adhere to. So we're saying that you can't arbitrarily select an intervention that's not related to one of these sort of main areas. So for weight in kilos, remember on that intervention bundle, check pages 8 through 10, and you'll see those key drivers are related to the guidelines and statements related to weight in kilos. Infrastructure changes within the emergency department. It could be that you are using a particular scale or you purchased a new scale that locks in kilograms rather than that lets you change the modality based on the patient. Interventions related to education, knowledge reinforcement for the care team, and then patient-family engagement. For abnormal vital signs, pages 11 through 16, those drivers or interventions should be based on, of course, your procedures guidelines. Remember, one major piece of the abnormal vital signs is how does the care team notify the physician that the patient's vitals are out of range, and so we have specific strategies that we want you to consider. EMR optimization is a big piece. We know this is a major sort of initiative, and so that may be a change strategy that hospitals decide to take on later in the year after they've received buy-in from their ED leadership as well as their IT support. Education and knowledge reinforcement, and then for interfacility transfer, remember, this one has an entire toolkit that's been designed with very detailed scripts, forms, and so we're encouraging you to adopt that into your procedures and policies. Education, communication, follow-up, patient and family engagement, and also EMR optimization and technology. And then lastly, you remember Bundle 4 is very different from the other three bundles. But those change strategies are very specific to the domains. And remember, we're only looking at the 4 domains listed here, which are disaster coordination, coalition building, surge capacity, and essential resources. I will say that for anyone that's working on Bundle 4, I really encourage you to attend their fireside chats or submit questions. Really take some time to look through that intervention bundle. We know that that team is going to spend some time during their first fireside chat talking about how do you actually host a drill exercise. And so that may be very meaningful for some teams to sit in on to get their ED management team involved. So that's something to keep in mind over the next couple months. And the one thing that's really important about Bundle 4 is that the disaster drill equals a PDSA cycle. So it's a very different sort of format. It's not like 30 drills is needed for your baseline, but one drill equals one PDSA cycle. So any questions about sort of the content that we've covered related to the baseline and the first PDSA cycle? We know that's a lot of information, and so what our plan is for today's learning session, when you go to our website, we'll include some of the information that Kate mentioned about data sampling, and then pair that with this information today about what to expect for your first PDSA cycle and your baseline, and hopefully you'll have a better picture of what to expect for the next 2 months or so. It looks like we didn't get any questions in, so now what we're going to do is move to the data entry system. And I want to make sure that Patti can hear us. Patti, can you introduce yourself to the team?
Yeah, this is Patti Schmiel. Can you all hear me?
Yes, we can.
Okay, great. I'm the NEADARC data manager and also do some IT work with websites and back-end development. So I'm happy to be with you. I'm planning on showing you a little bit more about the data entry system users guide that we've been working on and tell you how we hope that will be of great assistance to you as you are learning the system and looking for a guide.
Thanks for that, Patti. And so for trainers, this is an important sort of piece of information for you. There's going to be dedicated time in Austin to learn the ins and outs about this data entry system. And really the goal is to ensure that you're very familiar with the system and that you'll be able to provide secondary support to your affiliate sites. Keep in mind that NEADARC will still be the primary contact for any issues or concerns related to the data entry system, but we want to make sure that you guys are very comfortable using the platform. Mike, Ely, and John will be on site for that demo, and we have arranged for all of those attendees that have registered to get access in advance to the portal or the data entry system, so you'll have a chance to go in and tinker and see sort of what the fields look like before we do that deep dive in Austin. Another point that I want to mention is that we'll have those team profiles available for you before you go to Austin. We'll put them in a PowerPoint format so that you can add them into your slide deck that you'll be presenting to the larger team. It will include your data use agreement status, all the surveys that we've requested since the beginning of the collaborative, MOC enrollment for that hospital or for your team. We'll let you know how many of your physicians or nurses have requested CNE, CME credit. We'll give you some ideas about the QI stewards, how much of the IHI modules they've completed, which ones they've completed, and which ones are still pending. And then we'll give you some information about your data stewards, so particularly which bundles they've selected, and you let us know if there's been any changes. So, Mike, am I giving you control first or Patti?
You're going to give Patti first.
Okay, so Patti, give me 1 second, and I'm going to change you to the role as a presenter. You're going to see something on your screen that says passing controls. If you can accept that for me.
Okay, I don't see it first. I see Cassidy Penn.
Yes, that's me.
Okay.
On your top left, do you see share, file, edit, share? On the very top.
No, I do not. I apologize.
Okay, no problem. Let's see. If you...
I believe I can request controls.
Okay, go ahead.
Okay, I'll just share my screen.
Yeah,
Should I try that?
That's perfect.
Okay. All right. Can everybody see what I've
Yes, we can.
up here?
Mm-hmm.
Okay. So what we've been working on, I know we showed this to you before, is an online user's guide that you can use to help you get up and running. Basically a manual. You'll be able to print this out. On the home page there is a search bar immediately, so you could type, for example, Bundle 1, and it will show you right away different sections that have that word inside of it so that you can jump to those. But what I wanted to show you first, we mentioned about getting started last time, so I won't go deeply into that, but just so you know, anything with a little caret sign means that there's subsections underneath. So this goes into the requirements, the system requirements. We did add, just so you know, that the application will run in the Apple Safari browser and Opera browser, which is on a lot of Android phones. User accounts and logging into the system. So I wanted to explain how we have set this up. For the data entry system, there are basically two main screens that you'll be using. So one is called the workbench. And for these types of overall screens, what we do first is familiarize you with the different portions of the screen. So that, and we have numbers 1, 2, 3, 4, 5, 6 on this one. And below, we have area 1, area 2 to explain what these areas are for, so that you can get a feel for the overall screen and what various items mean. So that's one style we have, which is first how to get to know a screen and what is on it. The other one is entering site level information. So we show you how to get there, and then we do the same thing to explain the various sections of this type of screen. So these are the two main screens that you'll be working from. And then I just wanted to show you what we've done here. Under baseline data, for example, we have opening baseline data. So what we've really tried to do is to make this really easy and straightforward for you by using screen captures in step 1, step 2, so that you can know step 1, go to the edit site information box, click on this button. Step 2, we have instructions on what to do, on how to open the bundle for baseline data. Step 3, we have some information on how to enter data as far as a date. And I just wanted to let you know that there are various widgets that differ a little bit between browsers. So you may want to look at this in your decision to select a browser, because some allow you to hand enter dates and some you can only use the widget. So that could help you in your decision in selecting a browser. So we go through again the complete steps so that you will be ready to get down here where it says baseline active, and then go to the next step, and which is editing the information, the next step, which would be entering and submitting records. So again, we have the steps to actually get into a data entry screen, and we explain, the basics of the data entry screen and then how to enter data. So we hope this will be really detailed enough to help you get started, and we are working on various ways for you to print this to actually a nice format if you like to have it right next to you. And then we are also working on, we have a contact information page. We do have this FAQ, which will have questions that we've received from those of you who may contact our support. We can put your questions up here, and you can see what your colleagues are asking, and hopefully you'll find answers there. And then I just wanted to point out that under bundles and interventions, we will have, this is a mock-up, but we will have an actual screen that shows the survey in depth so that you can know which questions are required and how the skip patterns work, etc. And then we'll have a way for you to actually download these. So we're working on getting up this as soon as possible, and hopefully emailing out these survey to you so you can actually start seeing what types of data you will need to gather in order to use the system. So again, we hope that this overall get to know you screens and then the step-by-step system that we've developed will really help you. We've taken a lot of time to do screen grabs and go through it. Some of you, it may seem simplistic, and you can, do some quick site reading as you go through, but we really wanted it to be so that if I click on this, what should I see and what do I do next? So that's really all the update that I have for you all for the user's guide. We've put in a lot of work on this and a lot of information. We have just a few sections to finalize, and then this should be ready to go. So I will pass this back to Crystal. Hello?
So, Crystal, I think you're still on mute. Okay, she may have gotten kicked off. So I think at this point we were going to turn it over to Mike and John to actually show.
Hey, Kate, I just gave Mike control of the webinar.
Perfect.
Okay, so I have control now? Is that right?
Yes. It looks like we're seeing your screen.
Are you seeing my? Let me drag this over. I want to make sure are you seeing my screen?
Not yet for me.
Not quite yet.
So, Patti, can you give up? Let's see, Mike. Do you see the option to share your screen?
Let me hold on a second. I see
yeah,
share.
I did
Okay.
Stop sharing.
Do I click the share button?
Yes.
On my screen? Okay. Screen one. Okay. Here we go. I don't want you to see my email, so I'm going to drag this over. Yeah. Okay. Perfect. Let me just drag this over. Okay, great. Now, does everybody see my screen now? Hopefully. Yeah. Okay. Thanks, Patti, for the user guide demonstration. And let me go through a few things here on the data entry system. Just want to just give a little bit of a backdrop. We just before the holidays, we've been working on the data entry system and the user guide simultaneously, as well as trying to build up the prepare for the dashboarding system. But just before the holidays, we gave access to the EIC team to start playing with the data entry system and using it and populating it with records. Of course, then the holidays hit, and so that was busy. But then they've since entered a lot of test information into the data entry system, and we just had a call yesterday to review all the feedback that they had. They had some great ideas and suggestions, and so we're over the next probably 2 weeks. It'll take us to make the updates from those suggestions to the data entry system. So some of the things you're going to see right now on this screen are going to be changing, but that's good because everything, of course, is designed to make it a little bit more user friendly and intuitive for users. So let me show you how this works. So anyway, this is what we call the test PRQC site. It will actually go to what we call a production site once it's ready for you. But you'll go in and you'll enter your username, and I will show you how this works, and then your password, and there's a whole process we'll go through to get you a username, and then you'll go to the login page. So again, this will look very similar to what you just saw in Patti's user guide, but this is the actual live system, at least the test portion of the system. So you will, as a user, you will be attached, your name, we have to go through this process, but your name will be attached to your hospital. So when you log in, what you will see here is the name of your hospital, and you will only be able to enter information for your hospital. It will automatically be attached to your hospital. If by chance you're a user that actually has access to more than one hospital in the PRQC system, then we need to know that, and then you'll see a drop down, and then you will need to select which hospital you are entering data for. I would expect that may only be the case with network hospitals and may not really occur at all. But I'm on a test site, so I'm going to select test 2 because I want you to see what the screen will look like when you first jump in. Because when you first jump in, you will, of course, be the first time in the system. So what your screen will show is that you don't have any bundles open, nothing's active because, of course, you've just come in for the first time. So bundles 1, 2, and 3, they will all say not active. This spot here where it talks about active records will have nothing on it. And you'll have these 2 boxes here, site information and select bundles and creating a record. This is where you're going to spend most of your time in the data entry system. Ultimately is here in creating a record because that's where you're going to enter your patient record information for the bundle you're working on. But you can't do that until you have actually selected a bundle to work on and done a few things up front. So if I try to create a record here, I can't do anything. These boxes are all grayed out because I haven't selected a bundle I'm going to work on. All of that has to be done in this box over here, where it's just called the site, edit site information. So one key point to know is the first time you go into the system, you're going to have to go here to site information to activate your bundle and to get started. So if I click on edit site, then it pops up this box here, and it asks, basically select a bundle to either put in baseline data or PDSA cycle dates. Again, when you first start, you have to start with baseline data, so that's what you'll be doing. So if I were going to select it as my bundle to work on weight in kilograms, I would go ahead and click on weight in kilograms. Then it would open up a box below it that says bundle options and to start your baseline. If I start my baseline, I go ahead and put in a date, and then I hit start baseline. And then I'm actually ready to enter data for this bundle. So I can go ahead and actually, now I'm using the browser Firefox. And the widget in Firefox, one nice thing about it is you can actually hand type in information, or you can, it pops up a calendar here too. So if I were to select my baseline, and this is important because, again, as Kate just mentioned, you can go back to January 1st of 2018 to actually use patient records. So the baseline, let's say you started pulling records from November of 2018 of that month, and that was your 30 baseline records, or 30 records you're going to use for baseline data. But you're not actually going into the system to actually activate this until, say, March of this year, 2019. You're going to want to make sure you put in your baseline data is November of 2018. That corresponds to when your patient records, are being pulled from for your baseline, not March of 2019 when you're actually sitting down to enter the data. Because if you put in March, then it will be when you actually go in to submit your patient records, there'll be a conflict. So let's just say we're going to put in November. I'm going to type this in November. I'll just say November 1st of 2018. So go ahead and click that, and then I'm going to click Start Baseline. And now it says here, my bundle started. I can go in and edit the baseline start date if I want for some reason. But my baseline is started for bundle one, for weight in kilograms. This page again is being reworked based on feedback and discussions we had yesterday with the EIC team. We previously were thinking we were going to have folks upload documents that they might have related to the bundle, such as a policy on weighing children in the emergency department. We're not actually going to now have you upload documents, which will make it easier, but we are still going to ask you if you have a policy, for example, on weighing children in the emergency department, yes or no. If you say yes, then we'll ask you some questions about that policy. Does it specify that children be weighed only in kilos, yes or no, and some other questions. That's important because that will be used for the dashboarding information, and will help you to see as you make changes to your policies, how that corresponds to improvements in patient care. So this page will look a little bit different than it does now, but you won't be uploading documents, and that's a good thing because that could potentially be a little bit confusing, and there could be some issues with that. So that's how you start a bundle, and this basically works the same way when you are done. You can end your baseline when you put everything in for baseline, and then you can start a PDSA cycle, and it'll be very similar to how it looks for baseline. You'll just be selecting a start date for your PDSA cycle, and then you will be asked some questions about what key driver you're going to use and so forth, and then you'll be into a PDSA cycle. So let me jump back to the workbench here. now, let's see here. Let me, so for my site 2, I just activated my baseline for bundle 1, so now it reads bundle 1 is active baseline and the other 2 are not active. Let me jump back to test site 1 because I've already used this a lot and put in information in here, so you'll kind of see how it looks once you're actively using the data entry system. For test site 1, I have baselines active for bundles 1 and bundle 3, nothing in bundle 2. My workbench here shows what are called active records, meaning they're a record that I have started but I haven't submitted yet. So I can go back to those right here by hitting go to record. Once you actually submit a record, then it disappears from this screen and it's submitted into the system. So this allows you to work on a record, save it, and come back to it later if, for instance, you need more information or if you got pulled away for some reason or another. But let me show you now that, again, I have active baselines for bundles 1 and 3. I'm going to go into bundle 1, weight in kilograms. You'll see now that now I can actually go in and create a record because it allows me to check weight in kilograms to create a record. I can't do anything for abnormal vital signs because, again, that's not an active bundle I'm working on. So I'm going to go in and create a new record for weight in kilograms, and then I go here and click create.
Mike, can I, this is Kate, can I just comment on one thing real fast?
Sure,
which
please.
Is on the workbench that you all just saw, you'll see that it lists a system patient record number. These are randomly generated numbers, and it's really important that if you have any intention of going back and looking at a patient record, that you're actually keeping track of these numbers. I know we've talked about this in the past, but we are not using true medical record numbers. So the only way you'll know which system patient record number correlates to an actual chart that you entered is by maintaining some kind of tracking list, and that's how that's identified here.
And
yeah.
Kate, if I could just add on to that, on the user guide, we did add a template so that you can bridge those two between the system patient record number here and the actual patient record at your site.
Thanks, Patti.
Great, thank you. While we're back to the site, to sort of the main landing page here, I just want to point out these links up top. There are 3 links. One is to the PRQC dashboards, which is where, again, once information is coming into the system, we'll be using it to populate dashboards so that you can actually see graphs and see like how many records you've submitted and what bundles you're working on, and more importantly, what kind of progress you're seeing across time in terms of the bundle you're working on. Those are lagging a little bit behind the data entry system because we can't populate those until we have the data entry systems working. As Crystal mentioned, bundle 4 is actually not going to be, the data entry system for bundle 4 is different than here. It's going to be actually done in a REDCap form or survey, and we're working on that. We have that built as well, or building it, and hopefully we might have a minute here to demonstrate that. The link to bundle 4 will be right here, so if you're working on bundle 4, you can actually come in through this system and then link to it here, or you can bookmark the link and just go into it straight from on your web browser. The PRQC Users Guide, this is what Patti was just demonstrating. This is where you'll access the user guide, and we're going to build it so it pops up in a different window so you could actually have both windows open and hopefully be able to print the material from the user's guide, because that is really your guide for how the system works. So getting back to creating a patient record, I'm going to select weight in kilograms and click Create Record. This, again, is where you're going to be spending most of your time. Once you activate a bundle, this is where you're going to, the information that you've gathered from your electronic health record, you'll be putting into this system. This is the patient's record number Kate was just mentioning on the workbench that's automatically generated by our system. It's just it's a randomly auto-generated number, which corresponds to the to the patient record, the patient information that you're entering for the patient. This is the link that you'll need to you want to write this down so you know it corresponds to the number in your medical system. If you're going to be coming back and working on this record, because you won't be able to identify it from the workbench. I mean, it'll sit on the workbench here, but you'll need to make sure that you know which record this corresponds to in your electronic health record system. So let's just go through a record here. This is all just fake data, of course. Just so you know, most of the data elements and the questions in the data entry system are going to be required questions. Many of them are yes, no, or are dates, but they're required. So in order to actually submit the record, you have to have data entry in that field. So first question for this first section is about arrival information and mode of arrival. We'll say this is a patient that just walked in or came in through car. Date of arrival. This works. The widget works exactly like I showed you when setting the baseline data. This again, let's say we selected November of 2018 as our month. Let's say this patient came in on November 4th of 2018. So we'll go ahead and put that. The time of arrival, this is a 24-hour format, so you can't auto-type this in. You do have to use the widget, at least in Firefox. So let's say, the patient came in at 8 in the morning, so we'll click on that. Again, this works a little bit differently in each browser. So if you're using Google Chrome, it's going to be a little bit different, or Microsoft Edge, and you'll have to get used to it. But as Patti showed, there are screenshots of that in the user guide. Date of birth. We'll say this patient was born on April 17th of, say, 2008. There are logic checks built into the system, so meaning that date of arrival has to be after the date of birth. Date of birth will have to be before date of arrival. If that's not the case, you'll get an error message. Triage level of the patient. We'll select 3, but you can see the drop down here. It's got a numbering system and then as well as a color system. So that's my arrival information. Now let's say I get pulled away and I have to leave my screen right now. Nothing currently is saved. So if I were to hit go to workbench here or here, I would lose everything. So very important to, as you're working on this, to save your work. So I'm going to click save. And it'll say up here, weight in kilograms saved. And it takes me up to the top of the screen. You'll see here, this system number ends in 1114. I'm just going to go back to my workbench now. And now I have a patient record. This one right here, 1114, that is the one that I was just working on. And it says here, I'm in bundle 1 and I'm working on baseline data. So again, if you get pulled away, you'll need to know that this is the record here. This is the system number here that corresponds to the patient record number that you were working on. So Patti mentioned that we have a template in the user guide for you to keep track of that. So I'm going to go back here, go back to the record to continue entering data. This here is information about the policy that if you had a policy on weighing children in kilograms, it will just pop up here saying, this was your policy name and so forth. Again, you won't be actually uploading the document, but just the information about the policy. So this section here actually talks about, these are common elements for bundles 1 and 2. We built it so that if you were working on a record that spans multiple bundles, you can actually put in the information only once, which hopefully is a help to you if you're, as you get down the road and you're working on, you have a patient record that crosses multiple bundles that you're working on. But basically, you're going to ask the question, was there a weight in the medical record? If you click no, there's no weight in there, then you just go on to the next question about were there target medications administered. But if I click yes, the weight was in the medical record, and hopefully it is in the medical record, then it will ask you what units were the weight recorded in the medical record. You'll hit a drop-down button, kilograms, pounds, or both. So if I click kilograms, then it pops up the next question, what was the actual weight in kilograms? You'll see here there's a range that it can only be up to 200 kilograms. That's sort of just an error check on our part to make sure that something isn't accidentally entered that wouldn't make sense. So if I put, let's say the child was 45 kilos, I put in 45. Then I jump to the next section on medications administered. Were any target medications administered, yes or no? If I click no, and again, then I'm essentially done with the record. I can save my work, or I can actually complete the record at that point. If I say yes, then it gives me a list of what medications were given. And you see a whole list here of the type of medications given. So let's say this child got ibuprofen. I'm just going to click on ibuprofen, and then it asks specifically here for a dosing for ibuprofen, for the child. And let's say, again, there's a range here. In many cases, the range is greater than what would be a normal dose for a child. But we want to be able to capture anything that actually exists in the medical record. So I'll put in 15 milligrams. I'm not a clinician, so I don't really know what this should be. Then it asks for a route, and sometimes there's only one route available for a certain medication. Other times there might be more. So if we go to let's pick another one here, morphine. See, now it pops up morphine. How much was given? And then it asks for a route, and there's various routes that can be given, IV or intravenous or intramuscular. So I pick the route. And then I go ahead and I can save my work, which I always feel comfortable saving my work because, again, nothing's being auto-saved, so just make a note of that. Go to the workbench. Again, this is my record here, 1114. I click on it. Everything that I've been working on has been saved. All the information is in here. Now, if I want to go ahead and submit this record, I can do that. If I hit complete selected record, it's going to ask, I have to actually check this box first, that I'm completing it for weight in kilograms. And if I hit complete selected record, it will say it is completed. And now it's disappeared from my workbench because it's done, it's submitted, it's completed, so it's not an active record anymore. So now it's officially submitted record. That's sort of in a nutshell how the data entry system works. I just want to show you just going back to weight in kilograms. I'll do another create record, and I'll put mode of arrival. We can put ambulance. We'll put date of arrival. I'm just gonna select today's date, time of arrival. Date of birth. Now let's just go ahead and save this. Save your work. I've only selected part of this. Let's say I go ahead and then I try to complete it. And I select my bundle that says weight in kilograms, and I select completed record. You're going to get all these messages up here which say you couldn't close out the bundle. They're there just for a brief second, but basically what it's saying is there was an error on the page. Something's not right. If you then look, it will tell you for each data field that was either left blank that was required, or where a value was put in that's out of range or doesn't make sense. It will give you an error message. So, for instance, it says required. We have to put in a date of birth. We have to put in a triage level. We have to answer yes or no. Was there a weight in the medical record? And then we have to answer yes or no. Was there were any medications given? So if I go ahead and put in date of birth, I have to select something that was before. Well, let me do this just to show you this. I'm going to put in tomorrow's date on date of birth. And if I go ahead and click save, again, you can save anything you want. You can save anything you want. It's when you try to complete the selected record that will give you an error message. Okay, so now I have something for date of birth. But what it says now right up here on date of arrival is before date of birth. So it says that obviously doesn't make sense. So again, that's what I'm talking about when I say, it will pipe in errors. So let's go ahead and click this to something that actually makes sense. And I'm going to put in a triage level. I'm going to say that, I'm just going to say no weight was administered, or no weight was recorded. I'm going to say yes, that medications were given. And then I'm going to click Save My Work and complete the selected record. And I still have error messages because even though I've collected this and put in that information, I said medications were administered. Now it says at least one medication must be selected because I said medications were administered. So I go ahead and click that. Basically, the point is every field that you leave blank that's required, it will give you an error message saying you must complete this before you can actually submit the record. So those are the kinds of error checks that we're building into the system. There's a button here for removing a selected record if you want to remove it altogether, which I could click, and then it will give you a warning. Are you sure you want to remove this record from the selected bundle? I can say yes or cancel it. So that's that's basically how the system works. I'll just jump in real quickly to interfacility transfers. Create a record there. This is a more detailed bundle with more information. So again, much of the arrival information is going to look the same. Triage dates and times. Now this is the bundle on, again, transferring a patient. So if there's questions about did the patient meet the criteria for transfer, yes, no, or we don't have any site-specific transfer, let's say yes. Then we're going to ask the question, was the patient transferred? If you say yes, the patient was transferred, then a series of other questions pop up. What was the reason for the transfer? Some of these times, there's a number of times in here which are currently times and dates which are optional, but we're probably just going to remove just so it's more user friendly for the for the user. But what was the mode of transfer? We'll say ground ALS. The time of departure, that's a required field because we'll need that for the dashboards to actually see, what was the time of departure. Was there any kind of delay in transfer? If you say yes, then they'll ask, what is the delay? What was the reason for the delay? Then, did the receiving center return the transfer feedback form? So this is an example of a bundle, where you will be able to probably put in initial information, but then you'll be waiting for the receiving facility to actually hopefully complete and return the transfer form, feedback form to you, so you can enter in information from that site. Then there's some information on was the evaluation, transfer evaluation completed by the family, and then diagnosis and ICD-10 code information, and then you say, save your work. So again, save your work often. And again, it will say whatever you put in. It's just that when you go to submit the record, that's when it will give you the error messages if you've left required fields blank or have values that are out of range or don't make sense. And so again, you will actually be able to work on multiple bundles at the same time. Meaning if a patient if you're using one patient record for two bundles, this won't happen at first because we're asking you to just work on one bundle at a time while you get used to this, but it may be that you will in time work on two bundles simultaneously, and you'll have patients that meet the criteria for both bundles. If you create a record for both, you'll basically be entering all the information for that patient in one form here, and then it will create a record for that patient for each bundle on the back end. So I think I should probably stop now because we're running short on time and see if there are any questions. Again, I just want you to see how the system works. Don't expect you to remember everything we've talked about. And again, the screens will look differently once we make these last updates. Our plan is to have the trainers be using the system for us at the Austin meeting and before, so we can get some more feedback there.
Hey, Mike, this is Kate. There was a question that was asked just about specific recommendations for browsers. in your opinion, which one would be the best choice and what are the alternatives? I know it's in the user guide, but can you just comment on that?
And I don't know if Patti's on anymore. She may have jumped off. I do know I like Firefox, which is what I'm using now, only because you can hand type in those dates, and it kind of depends on what your preference is. But so again, the widget in well, if I put date of arrival here again, I can get a calendar and I can scroll through the calendar that way, or if it's just easier to hand type it in. I like Firefox because it allows me to hand type information in. So if you're plugging in information that you for your baseline that was collected last year, it's probably going to be easier for you to hand type it in rather than go through this. I mean, it just kind of depends on what your preference is, but I like the ability to hand type information. So Firefox is good for that. I don't think Chrome allows for that, but I haven't used Chrome as much.
Great. Thanks so much, Mike. And we are nearing the end of today's call, so I want to try to be as on point as possible just with the remainder of the time. But thanks so much, Mike and John and Patti, for presenting that. I know people are excited to see the data entry system is finally up and running and very, very close to final launch. Hopefully you guys are excited about it. We will give you opportunities to practice it and play with that, particularly the trainers, and to be able to provide some troubleshooting back to you all at the affiliate sites as well. So we had planned to also show the disaster REDCap data entry system, but I think given the sake of time, we may need to push that to the in-person training session with the trainers, and then also add it to maybe a future video or webinar that we can post just to walk you all through that. It's fairly self-explanatory. You saw the link from the data entry system. And it is a slightly different platform just because it's through REDCap, but they're linked, and there'll still be dashboards and all that stuff. So it is up and running and also in the final phases of piloting. So I'll turn it back to Crystal to finish this up.
So we are proud to announce that we formally have our PRQC website that's now live. Prior to today's learning session, all the trainers received the link to the website as well as a password for the private section. So you'll notice that the main public page has some very basic information about the collaborative design, some information about our intervention bundles and the goal of the collaborative. When you go to the members-only content, you'll see the archived previous learning sessions. You'll see all of the intervention bundles, and really that's the information that we're requesting that you keep private and not share with the larger community, just because we're validating these tools and going through the improvement process. And then lastly, we have a 2019 schedule. All the trainers have this, and our goal is to pass this along to, we've passed it along to all your trainers. It has the entire calendar for 2019 and also includes all of the call-in information. So I encourage you to go ahead and put these on your calendar if you don't have them. It also includes the fireside chats as well as our usual learning sessions. So Kate, what I'll do is just stop there, and what we'll do is post this on the website.
Okay, perfect. And I know we've gone over. If you could just talk about, the upcoming events, that's perfect, just so everyone can see those. I think that's great. Folks, I'm sorry that we went over today. Many thanks to all of you for joining, as always. We'll work on pulling some stuff up for the disaster bundle data entry system. Last question, when will the data entry system officially go live? It really depends on those last edits that NEATARC is going to be making, as Mike mentioned. Our hope is before the end of the month, but the official start date is still out. They are working feverishly to get this out as quickly as possible. Please know that you can absolutely begin to collect those baseline charts for data entry and be ready to move forward. So Happy New Year to everyone. To the trainers, we look forward to seeing you all in Austin. If there's any outstanding issues related to travel or the like, please reach out. You should have made your reservations by now and have everything set to go. If you haven't heard, we need to know. And we look forward to talking with you all on February 26th, our next learning session, if not before, during the fireside chats beginning as early as February 5th. Thanks so much, everyone.